Hello, I'm Professor Danielle Henderson,
And I'm Dr. Dulce Ruelas.
and welcome to our presentation titled Guiding Health Leaders, Mentorship, Insights, and Impact in Student-Driven Campus Wellness.
We are so excited to tell you our story, Pechacucha style. But we'd like to take this opportunity to acknowledge everyone that has contributed to this public health needs assessment. Connie Colbert, Wanya Higgins, Zarin Heltry, Kylie Carpenter, Lily Borick, Emily Orovos, Kayla Ballard, Sofia Talero, and Emiliano Villa. So, what is the importance of student-driven needs assessment? We had the opportunity to be able to collaborate with the Kenyan Health and Wellness Center. We served as trusted advisors who provided guidance, support, and expertise to help student leaders develop professionally and personally while they're shaping the future health here on campus. What better way to learn about college health than through these students? We were able to emphasize its value in public health and campus wellness by utilizing the Kenyan Health and Wellness Center collaboration with us as public health professionals and faculty. We had the opportunity to work with four student leaders that were interviewed through Kenyan Health and Wellness, holding a full-time course load and be able to learn what a health needs assessment is and implement it here at the GCU campus. Our role was to be able to be mentors and coaches and guide these students. We created a robust training manual so that they became city certified, learned how to develop surveys, and what their role as leaders on campus can be and should be. They were able to develop a survey. They chose the population of commuter students. We learned about different stakeholders along the way on how to be able to implement a survey. Did you know that we have over 6,000 commuter students on campus? So here's a little roadmap of what it took to be able to implement a health needs assessment. We met with the students from starting in August. They selected a population. We met stakeholders along the way. We held events at the commuter lounge and then implemented a 2-week survey through the Office of Student Assessment. We surveyed over 6,000 commuter students. Our target was 365 students, but we actually received 666 responses, which was amazing because, like I said, it was over 6,000 students. Here are some of the key findings. One of our questions was, do you know how to access the GCU Student Health Portal? 45% said yes, while 55% said they were not aware. Another question was the mental health and wellness awareness. We asked them if they were aware of mental health resources available as commuter students. 61% said yes, they were aware, while 38% said they were not aware. But it is important that this is a gap and it's an opportunity for engagement. So while mental health services on campus may be available, they are not as accessible to a commuter student's schedule.
In addition to mental health, we also asked questions on physical health and wellness. So here we asked, are you aware of the physical health resources available as a campus commuter student? 90.4% of students said yes, and 9.6% said no. Now, interestingly, when we asked students how frequently do you participate in physical health programs offered on campus as a commuter student, 64% said never, they never use those programs, and 20% said rarely. So while students are aware that the programs exist, as a commuter student, they are not using them. We also asked students about the biggest barriers they face as a commuter student that impacts their academic performance. 66.8% said time management was their biggest barrier, followed by 56.9% who said transportation delays, and 50.4% said social connections. So it's important to look at these as opportunities to improve services offered to commuter students. Every study has limitations, and some of ours included response bias, the fact that we were not able to test our survey before launching it, test our survey questions, our mode of survey administration, it was only offered online, which could have actually led to some survey fatigue because students are often completing surveys online through the Office of Student Assessment. Recommendations for campus health initiatives moving forward, we are suggesting targeting health services specifically for commuter students. There's so much potential in this untapped population to really have services that are specific to them. So the role of student leadership in public health. Students were empowered through this hands-on experience of conducting a campus-wide needs assessment. As Dr. Dulce said, they were involved in the whole process from, learning, getting trained through developing the survey, through looking at the results, and now through dissemination. So the impact of faculty mentorship on student growth. Being a mentor and a coach without a structured course was very challenging for both us and the students. We felt like we gave various opportunities and resources to provide guidance, support, and expertise to help students gain a skill set, but it was not always, students were overwhelmed often and in information and the amount of work, and it was difficult, and we had to keep morphing and changing our role. So future directions, replication of a needs assessment on campus will be easier the second time around because of the stakeholders that we have developed relationships with. And now we can suggest, conducting needs assessments with other populations on campus. So it's important to highlight the real world applications of this. So there is a broader need for a health education and health promotion office on campus. So projects such as this could be at the forefront and not something that the Canyon Health and Wellness Center is doing in addition to all of the amazing work it already does. So it's important to have, student-driven research and mentorship and allow students opportunities to have this hands-on experience as a part of their educational training.